No, there's a lot of information going around.
Sure.
A lot on the social media especially, some of which is scaring, some of which is causing confusion. So we wish to request that we shall be giving this information every day. We may not even have to come here. We shall be releasing this information every day. We had already released this information earlier today, but we are now promising that we are going to give this information regularly on a daily basis. Whether we have a zero case or not,
Sure.
we shall be giving you reporting. We are even proposing that we may even be giving this information at 10 p.m. every day,
Okay.
because most of our results come out around 8 p.m. Then we do some review, and then we release. So we estimate that every 9 to 10 p.m. every day we shall release this information. There is no point for us to sleep with the information which we know and release it the next morning, when especially Ugandans want to know what is happening. So this is information for yesterday, as of yesterday, 26, and we are releasing it now. We'll be releasing the information of today later.
Okay.
So the Ministry of Health wants to confirm 4 new cases of COVID-19 in Uganda. This brings the total number of cases to 18. You recall we had 14 cases, so we bring new confirmed cases today, 4. That makes the total 18.
Sure.
I'm sure people have been counting, and everybody knows we've been having 14. So with the addition of 4, we bring it to 18. Let me just give a little detail about the 4 cases, but of course, as you know, for professional purposes, we don't tell the names.
Let me just interrupt you a little.
March, and is currently under quarantine. He presented with signs and symptoms of COVID. So this is one of the cases, you remember, the Dubai cases. So he was really not picked at the airport because we were not picking Dubai cases. These are cases we called back from the community, and they came in Mulago. We took their signs and symptoms, and as a result of that, the health workers or the specialists at Mulago suspected the case, and we took off blood, and it turned out positive in Entebbe. So that is the first case. The second case was actually coming from UK, United Kingdom, came in via Netherlands, and that must have been on KLM, and was currently under quarantine. And as you know, we have doctors who keep going around and visiting these patients not patients, sorry about that, these passengers or travelers who are under quarantine in the different hotels. So when our team was going around, it found that this passenger or traveler had some signs and symptoms which were suggestive of COVID. So we took off blood and sent it to Entebbe. It also turned out positive. The third case is a 48-year-old female who also arrived from USA, and as you know, also USA, like UK, was among our category 1 countries. This one came in via Istanbul and is currently under quarantine. So the story of this one is the same as case number 2. So because he was coming from USA, he was taken into quarantine, and during the quarantine period, the doctors who were visiting these cases found that she had symptoms similar to COVID, and mainly cough and flu. So they took a sample of blood, and which tested positive. The fourth case was a 55-year-old male who arrived from Afghanistan, and this was a case who was not under quarantine. Actually, we want to clarify this. The earlier release we had said was under quarantine, but that was an error. This was a person who called in and said he was not feeling well, and he was suspecting he could be having a problem, and came in. The specialist concurred with him that the signs he presented were similar to those of COVID, so they took blood from him, which turned positive. So all these patients are being transferred to hospital, or have been transferred to hospital, except case number 4, who was in Hoima. So we have got in touch with him, and we have sent an ambulance to bring him from Hoima to Mulago. So these 4 cases were out of 197 who were tested yesterday. We tested 197 cases, and 4 were positive for COVID-19. As I said, that brings to total 18 cases who are positive out of a total of 423 that we have so far tested. We have so far tested 423 cases, and 18 have turned positive. Now these 4 and the previously identified cases, except the Hoima one, are all in hospital. 10 at Entebbe, and they are stable. The 10 cases at Entebbe Hospital are stable, and they are doing very well, except one who keeps getting fluctuating temperature. I think I mentioned the same yesterday. The temperature is still fluctuating. At one time it is okay, at another time it is down, another time it is high. But by and large, they are all doing well. 6 in Mulago, they are also doing well and stable. And this includes the 2 Chinese, because some people have been passing rumors that the Chinese are still in the hotel. I want to clarify and categorically state that they are in Mulago. And also this includes the child who came from Uganda. The case of Adjumani is still in Adjumani and is being managed in Adjumani. And the case of Hoima, as I have told you, we have not brought it back. All the previous, to date, we have a total of 1,184 who are still under follow-up. And this includes 811 who are under institutional quarantine. You recall the number I gave earlier has been raising because of the cases that we got from Mulago and we took in institutional quarantine after assessing in Mulago. You recall all cases from Dubai that we saw in Mulago, we took them for quarantine. The beauty about them is some of them had already spent a number of days. So let's say if you had spent 10 days since you came back from Dubai, so we just keep you for 4 days and release them. If you had spent 7, then you stay in quarantine for another 7. The point is that we want to see your situation 14 days after you arrived in the country from Dubai. So that's why you see the number under quarantine has increased from what we reported earlier. 373 are still under self-quarantine. You recall these are the ones who arrived before we started mandatory institutional quarantine, and the number has been going down because many of them have finished their self-quarantine. A total of 1,517 high-risk travelers have completed their 14 days of follow-up and have been issued with certificates of completion and mandatory quarantine. So, viewers, that is the situation. I would invite my colleague, the Commissioner for Health Education and Health Promotion, to give you the status of the call center. Because as you know, the call center has been challenging us, and my last visit here, my last update, I talked about the quarantine, the call center and how it was disturbing, and what we were doing to improve on the call center. And Mr. Kavanda Richard is here to give us a brief on what has been done, and maybe for him also to learn whether what we have done has improved the system, or if it hasn't improved the system yet, for him to assure us what is being done to make sure that that bottleneck is addressed. But maybe before he comes, because this is related, I also want to emphasize that going forward, we have sent contacts of district health officers and district surveillance focal persons. So somebody in Amudat now doesn't need to call the call center in Entebbe or in Kampala or at Ministry of Health. Somebody in Kitgum doesn't need to call that call center. Somebody in Rukunjiri doesn't need to call that call center. You need to call the district surveillance focal person or the district health officer, and those teams will come and assess or assess the patient or the person, and if it requires taking the sample, they will take the sample, and then they will send the sample to Entebbe for evaluation. So, Richard, please, you can come and clarify on what we are doing about the call center. Thank you very much.
I would like to make give a very brief explanation on what has been done by the Ministry of Health, arising from what was transpiring on Monday and Tuesday, given a number of people who were calling the Ministry of Health for assistance. You remember the minister gave guidance on where to seek information based on the signs and symptoms that arise from a number of people in rural communities. I'm happy to let you know that initially by Friday next week, the ministry had a number of 20 call center agents, and by the time we gave out results over the weekend on an increase in the number of people who had tested positive by that time, our call centers were overwhelmed with the number of people who were getting in touch with us. So as of now, we have expanded the call center to nearly 120 call center agents, and these have been these operate in 3 shifts. So we are operating purely a 24-hour services. So the ministry, working with partners, has also been positioned to develop a system which enables our call center agents to be able to give us real-time data or information based on what the different callers present. So the essence of the call center is to support us, number one, in providing the public with information, especially on the preventive measures that the ministry has been promoting, because we believe that there are those people who have not been able to get most of our documents. So we gave out the numbers of the call center to support us in that line. Number two, the call center also supports us in identifying cases. So usually we get alerts from our call center agents based on the information that the callers provide, and we are able to provide it to our surveillance officers who are manning different communities. So the system that has been developed helps us to provide alerts to our different officers in the different parts of the country, and we hope that that system will be able to help us be able to monitor and also get in touch with the different individuals who may need our help. The other key issue about the call center, we are calling upon the public, because though coronavirus is in existence now, it doesn't take away other health-related conditions. So we call upon the public that given the magnitude of the problem, we are requesting the public to only get in touch with us if they only feel that the stated signs and symptoms for coronavirus are the ones that are affecting a particular individual or you yourself. And also, to support that, it would also be better if the individuals, those who may think that this may be as a result of coronavirus, have a travel history, or having been close or in contact with those persons who have been tested positive, or those who had traveled in different parts of the country. So the other 2 initiatives which we think that, you remember last week we had different reports. One indicating that a number of our village health teams did not have enough information on issues relating to coronavirus. And we have worked out a mechanism still through having a separate platform that is going to enable our VHTs, whom we call the village health teams, to be able to access all the basic information and to be guided on how they should handle different cases in case they are being reported from different communities. So I think with that gives us a very good picture on how we are progressing, and we hope that that will also support us in engaging more with the public. Then lastly, on the issue of the call center and also engaging with the public, we worked out a mechanism with the Uganda Communications Commission, and we have been able to secure another toll-free line, which is easier, and that is 919. So we hope that this other new toll-free number will be able to support and make it easier for the general public to be able to call and seek more clarifications on a number of issues pertaining to coronavirus disease.
Well, thank you so much, Richard Kavanda, the Acting Commissioner for Health Services and Health Promotions, just right there. Now, with us here, we also have members of the Fourth Estate who shall be asking you some questions. But before they actually come on, Dr. Mwebese, how are you managing information? And because I think there should be a way of how we should actually wait for information to come in through you or from you, because when information comes out and it flies through the media and all the other social platforms, we really do not know whether it's actually authentic or not authentic, and we just need to know that. And also, just help me know, for these people who come and they are tested, how do you break the news to them? How do you tell them? How do you actually tell them you are not going back home, you are positive, and we now taking you to hospital or thereabout? What happens to them, and how are they responding in that way? And maybe the other question would be, are people freely coming through and responding? Because there is a message on social media, I do not want to think it's authentic, but it just worries me that it is everywhere, of a couple that came in, I think from Dubai, and they say they spent the whole day yesterday in Mulago from 6 o'clock up to about 6 o'clock. They went to Entebbe, they went to Mulago. It's on social media everywhere, but they were not tested, and I did not know what happened. So I think, well, if it's true, then it downplays all the efforts that we're trying to do as a country to see how to manage the pandemic. And if it's not true, please let us know how we actually still need to manage this. You're welcome again, Dr. Mwebese.
Thank you very much once again. Managing the information, that's why we are saying that we shall be giving you the information regularly, every day at an agreed time, so that it excludes all these ones who create their own stories and start creating their own positives and negatives, so that we shall be giving you authentic information from Ministry of Health. So the only authentic information you'll be getting will be Ministry of Health. So if you see anything before which is not from Ministry of Health, that 10 new cases have been confirmed, if it is not from Ministry of Health, then you disregard that one as not official information. Because as I told you, we normally get our information around 8 o'clock. So by 10, we should have released the information to you. So if somebody is releasing information like now for today, then certainly that's not authentic information.
Very good.
And don't take it as authentic information. All information from Ministry of Health will be signed either by me, Mwebese Henry, or by the minister.
Okay.
Then how do you break the news? Of course, we also have, first of all, some of these people are in quarantine, under quarantine, and some are not under quarantine. But majority of them are under quarantine. So we go and discuss the results with the people.
Okay.
Of course, you don't just come and throw in news to somebody that, you know what, by the way, you are positive. I mean, you don't do that. So you go with the team and discuss with the person, with the counselor, and explain that out of the results or the tests that we did, your test was positive, and this is what it means. It will require you to be taken for treatment. The treatment may take so long, and we'll keep monitoring you and supporting you the chances are high you will survive, you'll be managed professionally, and cancel them and take them for proper treatment. So we do not throw the news to somebody anyhow, because, I mean, this is not news everybody is eager to receive. And that's why you see the anxiety, what is around, because people are very anxious. Everybody is scared, and especially when we received the first positive cases, everybody became very anxious. Before that, we realized people were a bit comfortable. But from the time we got the first cases, then people got anxious. And that brings me to the next case question you said about the person who went to Mulago and was between, you said, 8 a.m. up to 6 p.m. and was not attended to. You know, the issue we've been having in Mulago is that we've been having 2 rounds of people, types of people. What we requested people, you remember we said that all those who had traveled from Dubai between this date and this date, please report to Mulago for assistance. And that was between 10th and 22nd, I think. Actually, we said, yeah, because we were talking about 10th, we were looking at people who had finished their 14 days, and 22nd when we closed the airport. So we wanted all of those to come back to Mulago, and we assessed them, having realized that all the positive cases that we had received had come from Dubai. So what happened is that everybody took advantage of that. And the anxiety in the community, everybody wanted to come and test. The community helped to try to push people also to go for test. But then they took it a step too far by starting to chase people out of the villages, out of the towns, out of the suburbs. So that made also the story a bit more complicated. So Mulago was swarmed by a big number of people, more than the people we expected. Well, we expected the people from Dubai, and we gave them priority because we really wanted to screen them and then isolate them and quarantine them. But then we were swarmed by a number of people who were coming from everywhere, Kawempe, Boise, everywhere, everybody came and tried to make the whole exercise a bit difficult. So that's why we tried to make sure that we prioritized. We started a triage and made sure that we said, look here, let's first work on the group which we wanted, because we thought that a group staying in the community may be risky. Because like you see here in the results, most of these people are people who came from outside. So we wanted to make sure we remove those people from the community, put them under quarantine before we make any arrangements for any other people who are just anxious. So that's why I suspect this person was really not from Dubai. He must have been one of those who were anxious and wanted his test done, but was using the excuse of saying he was from Dubai. Because all those from Dubai were given a preferential lane, because we really wanted them to be screened and taken out of the community and isolated.
Okay. Well, thank you so much, Doctor. Members of the press are here, and I think if any of you is here and you would love to ask a question to Dr. Mwebesa, please, you just need to, come on the podium, say your name, and just ask a question, make it brief, and let the doctor respond to it.
My name is Zahar Namuli. I am Zahar Namuli, a journalist with NBS Television. Dr. Mwebesa, on the Hoima case, have you been able to identify the contacts of this particular case? And when had he returned? The press release said he returned on the 26th. So have you been able to identify all the people that this person has been able to meet? Then on the instruments that were earlier released, can we please let the public know when a family member or a close person is tests positive for COVID, what are the criteria? We've seen people in Mulago trying to visit their people, bringing them foodstuffs. How is it supposed to be done when somebody is positive? And by bad luck, when they do die, what is the procedure of putting these people to rest decently?
All right.
Good afternoon. My name is Walter Mwesiji. I'm from NTV. I'm going to ask my own questions and a couple of others from journalists, of course, international journalists, but who are Ugandans and they are concerned. First of all, we want to know the situation at Mulago Hospital. Is it as it is portrayed from, social media videos? There's a video that was making rounds. People complaining they don't have food and nobody is attending to them. Then also, the question of, self-test. Are members of the public open to being tested if they wanted to carry out their own personal tests? And how is it done? We also want to know about the supplies. Do you have enough supplies? Is there a shortage? And how are you dealing with that? And finally, we also want to know about addressing stigma. Because the way we came out at first threatened people, they started running away. So how are you now addressing, because you created awareness, people are putting on masks, but now there is some kind of stigma which makes the community actually hide, or the people who could be infected hide. And then also the issue of nutrition and alternative sanitizers. Of course, you've emphasized that soap and water is the best alternative if you really don't have a sanitizer, but we still hear messages of nutrition, vitamin A, vitamin C, and all those vitamins, plus alternative sanitizers using Jik and whatever. We want a clarification on that. And community transmissions, do we still have, or from the case of the gentleman in Adjumani, can we say that now we have local transmissions? And also, did you find all his contacts?
Well, thank you so much, Walter. Any other person with a question as the doctor comes and respond? I think the other thing that you also need to address us on, Dr. Mwebesa, is the use of masks, because we're told those who are putting on masks are actually the ones who are sick, and we just now need to know whether we should put them on, we shouldn't put them on. I think it's also very important. Any other person with a question here? Okay, just step on the podium here, tell us your name, and of course make your question brief.
I'm called Navdia Shamshad from Bukede TV. Mine is a complaint from the community.
Complaint?
The community. The community they complain that the numbers you give out, they are not being answered. However much they call, they are not being answered. And then if they are answered, the doctors don't turn up.
Okay.
That was the complaint.
That now goes to the call center. People call, the expertise. People call and they're not responded to, and when they respond, they again do not turn up. Let's have another question here before Dr. and Mr. Kabanda here respond to your questions. Please make it brief like Bukede did. Again, it's okay. Welcome.
Precious, I'm Sibo. I work with Monitor Publications. I have several. I hope you'll allow me. There's information that government has deported some individuals over coronavirus. Could we get to know who, if there are any, and how many there are, and what nationality? Then the missing Dubai suspects. Have we tested every Dubai people, that the returnees? And how many are remaining? How do you trace these individuals? But also there are people who have been who have abused the quarantine, especially the government officials. How are you handling this situation? And there's a question of mass testing. Do you think we require it at this moment? Do we have enough ICUs as the cases are increasing? How many do we have? How many will we need? And how many have we traced on these contacts? How many contacts have we traced so far? When we look at the fight since it started, in the prevention and now post, how much money have we used? How much money will we need, since we do not know how long it is going to take us? Then who takes the care of the feeding of these people who are already confirmed in hospitals? And in the event that I got the symptoms, you've told us we self-isolate ourselves, but remember I'll be in pain. So what other measures can I use as I wait for your help? Do I take Panadol? We need to know how to manage as we wait for your help. And on the issue of the baby, how long does it take you to release results. How then, because there is a lot of speculation on how the Elugu man, the Adjumani man, and the baby contracted the virus. So we'd like to know the status and how these people, because they have not traveled out of the country, especially the baby. What is the status? Thank you.
Thank you so much, Patience from Daily Monitor. I think yes, those are good enough for you to, just as a code seal up at the baby one, somebody had actually sent it here to know the update and who is taking care of this baby. And they also need to know, because we talk about an 8-month-old baby, is she breastfeeding or is it breastfeeding, all the things, and how they're actually managing it. Welcome to respond to the questions again.
Let me start with the last one.
Thank you.
Just to clarify, you recall when we were releasing the results of the baby, we told you that that baby, the father had traveled from Kenya in Kisumu. And we suspect the father was responsible for transferring the disease to the child. And our teams have been to the place, and the mother was negative, actually. So the mother was negative. We suspect the father could be the one who infected the child. And a sample has been taken from the father, because the father initially disappeared, so we didn't have the father. So he initially disappeared, and we didn't get the father test, the father's sample. But now the father has come, and we took the sample from the father, so we shall eventually confirm. The tricky part will be if the father tests negative. Then we shall have a lot of thinking to do about that case. Who is looking after the child? It's the mother looking after the child in Mulago. Let me go back to the start. We started with Zahara, I think. The Hoima case. The Hoima case we have sent, as I said, we have sent a team to bring him. But of course, for any case who turns positive, we have to send a team of epidemiologists to do surveillance for all those contacts who are been in touch with this person. Now, this one is one of our tricky one, our complicated one. This one together with the one of Adjumani, because certainly over time, and interesting. First of all, I want to correct that. In our earlier release, we said he came on 26. That was a mistake, because even 26 March, the airport was already closed. So this man came much earlier, and we are trying to review from the records when we have to get the records from immigration, because we actually don't know when he came. You recall, this is a man who reported himself. He said, I'm not feeling well. I have these symptoms you are talking about. So when he came, the clinicians reviewed him and said, in view of his signs and symptoms, this is a person we must test. And indeed, when we tested, he was positive. So his travel history is not very clear, much as he came from Afghanistan. But the team has gone and will do all the contact tracing. So why am I saying that this one is a bad case for us? He has been in the community for some time, so he must have interacted with a number of people. So certainly he has many contacts. Well, the other three, you realize they are under quarantine and they have not been in the population. So I want to believe now the population now realizes the importance of quarantine, because these people were contained somewhere in a hotel and have not interacted with other people. So we don't have a very big risk with these people, especially if they were observing the rules of quarantine in the hotels where they were. So we do not expect a lot of contacts with these people, and most likely not a very big harm to our population. But this one and the one of Adjumani, whose travel history we didn't know, the man was there selling his salt in the market and interacting with many people. So those are really cases who are worrying us a bit. Test positive, I think that one I had answered. Oh yeah. How is the situation at Mulago? The situation at Mulago, apart from the daily people who come in and the crowding, the people who are on the ward, there's no big problem. Actually, there's no problem, because in Mulago, we have the whole of Block A dedicated to the patients. And that ward has about 270 beds with very good spacing, with social distancing, with about 4 meters apart. Actually, the whole cubicle we put on, which is supposed to take, I think, 12 patients, we have in only. In the normal situation, where we have 12 patients, we are having 4 patients. So there's very good spacing. Facilities are very good. The hospital is recently renovated. The food is available. We have only 6 patients. Can we feed 6 patients? I saw some social media running around that the child was not fed. Surely, can we feed 6 patients? If Entebbe smaller hospital has been feeding 9 patients? 10 now. 10 patients in Entebbe. We have only 6 patients in Mulago. But the feeding of patients is our role, and we don't expect any relative to bring food for this. In any case, we will not be allowed to reach these patients anyway, so there's no way you can bring them food. Because you'll bring them food, you'll want your containers back. And you want your containers back, those containers have been used by these patients, they have to get a way of being washed thoroughly and disinfected. Self-test, we are not encouraging it yet. What we are encouraging is people should get, you report, we take your sample, and we test it for you. We are still discussing with our donors the issue of rapid tests. When we get rapid tests approved by WHO and by other authorities, and we find them validated and correct, then that will make it much easier. We may even allow some private hospitals or other hospitals to do rapid tests. But as of now, before it is approved, we cannot allow self-tests because they have not been approved. How are we doing in terms of supplies? As I told you before, our treatment arrangement is national referral hospitals and regional referral hospitals. So we have already pre-positioned materials for protection and materials and supplies in all our national referral hospitals and our regional referral hospitals to receive any patients that may come in place. We are, for the time being, we are not managing cases at the general hospitals and at health centers, because the cases who are still there are still few and can be managed at this level. If we reach that scenario where we require to go lower, we shall inform you. The issue of stigma, this is very true and it is real, but it is actually the way Walter talked about it. It was like he was saying the ministry is the one which has introduced stigma, but actually it is the reverse. In our enthusiasm to request people to come, it made the community very enthusiastic and looked at the people very hostile, and they thought that everybody, if you came from Dubai or if you came somewhere, must be chased out of the community, out of the suburbs, and that is what is causing a bit of problem. So we are trying to educate the community to stop this stigma. You know, we've gone through this in phases. We had that problem for HIV, we have it for TB, we have it for a different number of diseases. So what we are advising the population, that much as they advise the people to come and seek assistance, they should not harass people. Actually, one of the problems we have with Mulago, people are being chased away from the suburbs. People are being harassed. You people, you came back from Dubai, you are not supposed to be here, you should go away. So the people are running away. There are people who were there around 10 p.m. and say, well, I can't go back home because I'll be, people will mob me. So the problem is the community we need, and as I address all those listening to me, I want to urge our community to stop harassing the visitors, not the visitors, the people who have returned from abroad, but we just encourage them to come and report and be supported. Alternative sanitizers, we still encourage people to use soap and water, but if you can afford, you can buy sanitizers, but make sure that the sanitizer has at least 80% alcohol. That is when you can be very sure of that sanitizer. But otherwise, wash with soap and water and wash for at least 20 seconds. The issue of nutrition supplements for treatment is really more of a supplement, just supportive treatment, but it is not curative. It is just support, like you say, eat well. Yeah. If you take vitamins and what, it is just like we would say go and eat dodo, eat fruits and the like. It is just supportive. Do we have community or local transmission? As of now, we haven't confirmed it yet. Until we confirm it, then we shall say we have community or local transmission, especially if we visit Hoima. The team from Hoima and Adjumani, if they find any new cases which have been transmitted to the population from these cases, then, and we shall get that answer very soon, because as they go there, they look at all contacts, and they'll be getting samples from them, and they'll be advising us accordingly. Patience, have I finished your questions or we haven't? No, yes, I think Patience Monitor haven't answered your questions. You asked that government of Uganda deported some people because of corona. I have not heard about that. What I know is even the border is closed. I don't know where they will pass. But the government has not deported anybody. So how, I didn't understand this question. How would they deport them? Because they have coronavirus? No, we haven't. Even the Chinese are still here. As I told you, they are in Mulago being treated, and there is no reason for deporting them. It's not in our line to deport people. I don't think it is even allowed, unless they have other crimes. But on health grounds, we don't. All Dubai, have we got all the people of Dubai? No. You recall I told you we have 574, the ones we are targeting to get from, who came from Dubai for the period under review. If you came from Dubai before tennis and you already finished 14 days and you have no symptoms, we had no much interest in you. But the people we had interest in were the ones who came in the last 2 weeks, and we have 574. We have only managed to get 279 through the screening at Mulago, and as I told you, we have only received, I think, 4 who tested positive among the list. Is it 4? The 6 we received earlier, the ones we received earlier were not part of the Mulago screening, no. Part of the Mulago screening, these are the first ones we are getting positive. So we encourage them to come. It doesn't mean that you came from Dubai, you are automatically positive. We encourage them to come and complete their screening and complete their areas, their days of isolation. Mass testing, I think I've answered that one. We are not doing it until if we get rapid diagnostic tests, we shall do a lot more testing than we are doing now. But even that one, we shall do it only for those who have symptoms and signs. Do we have enough ICU? Yes, for the cases that the scenario we are anticipating. We have 36 beds, very modern ICU beds in Mulago, with state-of-the-art equipment in New Mulago, and about 27 for pediatric. The 36 are adult, 27 are pediatric. In the event that we need more beds, we can also look at the women's hospital. The women's hospital has 27 and has, I think, 33 pediatric. I don't remember the exact number, but in total we have over 63 beds, ICU, modern ICU beds in Kampala here. Then in regional referral hospitals we have beds, 12 in Mbarara. We have in Kabale, which we support from JICA. We had about 8 beds there. In Hoima we have 8 beds. Jinja we have 12 ICU beds. In Ugulu we have in Lacho about 12 beds. Where else? I think those are the main ones. So and remember, by the way, the people who require ICU are almost 5%. The majority of 80% of them get simple condition and get done or treated and live without needing without getting severe cases or reaching for critical. It's only about 5% which becomes critical. How much money have we used? What I know, we received 5 billion from government of Uganda, and that was according to our scenario 1. And we sent most of that money to national medical stores to buy supplies, and kept about 1 billion for the routine activities being done, especially the teams who are going up and down and buying some of these masks and thermometers for the case finding teams. What can I take as I wait for help when you have done the test? We have a psychosocial team after taking your lab or sample, and then that psychosocial team normally supports you as you wait for your results. I think Richard can come and talk about the masks. The masks, we still don't encourage people walking around with the masks really. Our emphasis is use a mask if you are looking after a patient or if you are coughing and sneezing yourself. But if you are not coughing or sneezing, it's not required to use the masks.
Okay. Well, thank you so much. Mr. Kabanda, could you please respond to the toll-free numbers that are either not received or when they are received, there is no response that comes through to the public? That question came from Bukede.
Okay, there are two issues here.
Okay.
One of them was partly addressed by the DG on issues of stigma in the communities, and that has quite a lot to do with messaging, and of course the approaches which we hope that have to be used by even our local leadership within the different parts of the country. And then the other issue of the call center. So on the issue of the call center, as I stated, many people still take the social media messages that we are running on Monday and Tuesday, and they still think that the responses of our teams has not been in line with the demands that we have as per the information sharing from the Ministry of Health. But as I said, since yesterday we have been able to make some good advances, and our agents are now available all the time, and of course it may be possible that someone can easily call and you find the phone busy, but we call upon them to try again. But also hope that opening up a new toll-free line for 919 will be able to solve most of the key issues pertaining to delayed provision of information. Lastly, on the issue of stigma, we call upon members of the community, because what has been circulating is that whoever is found coughing or sneezing is taken to be having coronavirus. But COVID is not taking away other illnesses, and we call upon the public that if they have all other illnesses, it's better for them to visit our health facilities which are all over the country, so that that assessment is being done by our health professionals before they are being sent. We have a case definition for corona or for COVID-19, and it is upon that case definition that will determine whether the person should be referred for testing or screening or not. So we are not closing our health facilities. People should still visit the health facilities because other health conditions, things like flu and cough, will still exist in our population. Thank you.
Well, thank you so much. Mr. Kabanda, just before you step off the podium, I just want you to recollect all that, sum it up, what you've responded to and what the Director General said in Luganda, especially for the public that wants to know these details in Luganda, before the Director General again comes to say his last comments.
Okay. Ministry y'ebyobulamu etegeeza eggwanga lyonna nti olunaku lwazibidde olweggulo nga tufunyeyo abantu abalala 4 abasangiddwa nga balina obulwadde bwa coronavirus oba gye tuyita COVID-19. Abantu bano 4 beegatta ku bantu 14 be twalangirira gye buvuddeko, era ng'omuwendo guno guweze gwa bantu 18 mu ggwanga lyonna. Abantu bano 4 kambogerewo katono. Wasooka ye mukyala ye mwami nga ono wa myaka 31, era ng'ono yava Dubai ng'ennaku z'omwezi 2 omwezi ogwokusatu omwaka guno gwennyini. Omwami ono yasangiddwa ng'ali mu bantu bano era abangi be twateeka mu kituyita institutional quarantine, era nga okugenda okumukebera yasangiddwa nga atandise okuleeta obubonero obw'ekirwadde kino. Omulwadde owokubiri naye mwami nga wa myaka 29 nga ye yava Bungereza era nga yayitako mu Netherlands era nga mu kiseera kino naye ali mu institutional quarantine. Era ono naye yalaze obubonero bw'obulwadde bwa COVID-19 okukolola ate wamu n'omusujja kyetuyita fever. Omulwadde owokusatu wa myaka 48 ono mukyala ate nga ye yava mu United States of America yayitirako ettaka mu Istanbul era ng'ono naye ali mu quarantine. Omukyala ono naye okufaanaganako ne bali abalala naye era yalaze obubonero okuli okukolola ate wamu ne senyiga nga kikyaviiriddeko abasawo baffe okumuggyako test ne basobola okumukebera. Omulwadde owokuna nga ono omwami ono yavudde yali ava mu Afghanistan era ng'ono naye ali mu quarantine. Ono naye yalaze obubonero obulaga ekirwadde kya COVID-19. Bw'otunulira abalwadde bano bonna oba abantu bano bonna abasangiddwa nga balina obulwadde bwa coronavirus ng'era bali mu institutional quarantine, kikulaga amakubo nti agateekebwawo government ndala ministry y'ebyobulamu okusalawo gamba nti abantu bonna abali batambudde nga bavudde mu nsi ez'enjawulo batekebwe mu kifo ekyawamu batunulirwe ate bwe bazuulibwa ennaku 14 bwe ziba nga ziweddeko ng'oli talina bubonero bwonna bw'alaze aba asobola okuweebwa certificate n'atambula n'agenda. Ate omuntu singa aba ennaku ezo nga tezinaggwako n'alaga obubonero bwonna, omuntu oyo akeberebwa ate abasawo baffe ne bazuula okulaba oba omuntu ekimuliko kya bulwadde bwa coronavirus oba nedda. So twongera okubira omulanga eri abantu baffe mwenna okwongera okutwala ebiragiro bya minisitule y'ebyobulamu ng'ebikulu kubanga singa abantu bano baali tebali mu bifo mukuumibwa bantu abaali bazze mu ggwanga bavudde mu nsi endala bandibadde bamaze okusiiga abantu baffe obulwadde. Ku bantu bano bonna bwe twogeddeko kati 18 abantu 10 bakuumibwa mu ddwaliro Entebbe gye tuyita grade B era nga bali mu mbeera nnungi. Abantu 6 bakuumibwa mu ddwaliro ekkulu e Mulago omuli omwana ate era kuliko ne bannaffe abaava mu nsi ya China. Bwe mujjukira obulungi abaakeberebwa ne basangibwa nga 2 ku bo ate balina obulwadde bwa coronavirus. Wetukidde olwaleero nga abantu 1,184 abasawo baffe babalondoola era babatunulira okulaba oba balina obulwadde oba tebalina. Ku bano abantu 811 bakyali mu bifo omukuumibwa gye tuyita institutional quarantine ate ng'abantu 73 bo beekuumibwa bokka. Mujjukira mulundi ogwasooka twali tukubiriza abantu okubeera mu self quarantine, so tulowooza nti n'abantu bano bwe banaakuumibwa obulungi mu bifo byonna gye bali kijja kutwanguyiza wamu nga ministry wamu n'abasawo baffe okusobola okulondoola obulungi ate n'okuzuula okulaba nti abantu bano tebasaasaanya bulwadde okubaako nga kwabo kuliko omuntu alina obulwadde obwo. Tukubiriza abantu baffe bonna gye muli eyo mu byalo, abantu baffe bonna betwakoola okujja okubakebera nti muleme kubatunulira ng'abantu ab'obulabi kubanga bali bamu ku mmwe era nga n'abantu abasinga obungi ku bano tekitegeeza nti nno omuntu aba avudde mu nsi y'ebweru kwezo zetwayogerako tegeeza nti omuntu abeera alina obulwadde oba n'okusangibwa omuntu ng'akolola obanga alina olusujjasujja oba senyiga nebala bifaanako bityo tekitegeeza nti nno omuntu alina obulwadde bwa coronavirus. Twongera okubasaba okubeera obulindaala mu byalo byaffe byonna gye muli n'okusobola okugenda mu maaso nga mukola ebyo bye twateekawo bitulowooza nti mu kiseera kino bijja kuyambako muno. Nga tumaliriza mulimu okwongera okukubiriza bannaffe okuteeka amaanyi enkola ey'okunaaba mu ngalo nga munaaba engalo zammwe okumala obutikitiki obutaka wansi wa 20 oba okukozesa obulagala obunaaba mu ngalo naye nga buno bulimu kitwandise alcohol content kuba bw'otunuulira ku kacupa akatundibwa kaba kakulaga ebirungo eby'enjawulo bibeera mu ddagala lyonna oba mu kacupa ako, era bw'osomako bw'osobola okulaba ebirungo ebirimu baba bakulaga bulungi, so bw'osobola okulaba nti kuliko ebitundu 6 ku 100, ebitundu 5 ku 100 oba ebitundu 7 ku 100. So nga ministry tuwabula nti kyetaaga omuntu okubanga akantu konna kakozesezza kasobola ddala okubanga kaweza ebitundu 6 ku buli 100.
Ebyomwenge kyogere nti ebyomwenge
ebitundu 6 ku 100 ebyomwenge ogubeera guli mu kirungo ekyo. Okujjako n'ekyala ekikulu okusobola okulaba nti bannaffe andala abantu boba ng'oli nabo nga tobategeera bulungi, tobadde nabo, musobola okwekuuma nga mwewa distance oba ebbanga erimala kusobola okulaba nti oli newaba yeyasamudde oba newaba akolodde aba atasobola ate kukusiiga bulwadde. Maliriza nga ntegeeza eggwanga nti minisitule y'ebyobulamu yayongeza ku bakozi baayo abali mu kifo w'osobola okukuba essimu era w'osobola okubafunira okuva ku muwendo gw'abantu 20 gwe twalina sabbiiti eyaggwa okutuuka kati ku bantu 120. Era nga bwe mwategeezebwa gye buvuddeko twayongeza ku muwendo gw'abantu ate ne twongeza ne ku layini ez'enjawulo omuntu zasobola okukubako naba nga asobola okwogera n'abantu baffe abasawo baffe ab'enjawulo. Tubakubiriza nti olw'okuba nti tusuubira omuwendo gw'abantu okuba nga mungi, abantu baleme kubeera mu kutya, aleme okuba bw'abanga awulira nga alina obulwadde obulala bwonna bw'abasobola ate obusobola okujjanjabwa abasawo baffe ab'owansi. Era mukwongera okulaba nti abantu abasinga obungi abali mu byalo batuukizibwako enkola eno. Abasawo baffe abali mu disitulikiti ez'enjawulo abasinga obungi twabategeezeza n'ennamba zaabwe zonna twaziwaddeyo. Twongera okubasaba nti kusobola okwanguya omulimo gw'okulondoola n'okulonda abantu abetuyinza okulowooza nti no balina obulabe, tujja basaba abantu bakube ku namba z'amasimu ago agali mu disitulikiti ez'enjawulo, era ge tugenda okwongera maaso nga tuwa radios ez'enjawulo eziri mu bitundu eby'enjawulo ate ngera tuyita ne mu makubo amalala. Mwebale nnyo, mwebale ddala okutuuliza.
Well, thank you so much. Dr. Mwebesa, because you're the most competent person and authoritative person at this time to speak and to talk to us about this thing, I would just request that before we let you go, could you please just again step on the podium there to just give clarity on what possibly we may not have understood well. Your response to how much money that the patients here from Daily Monitor asked, just dispel the text message that came in through here to say that you've used about 112 billion shillings, which is about 1 billion shillings every day. So I think we need emphasis on that. And to also let us know whether the 5 billion that you've received so far is enough. And if it's not enough, we know we're fighting with a pandemic that we do not know how to ably control, and it's really disaster to us. What could your projections be in case? I am a Christian and a very strong believer in the Lord. I pray against any death that may happen to us, but I also do believe that it can actually happen to us some other time. Zahara of NBS also wants to know what you will do or what the plans are should we register a case of any dead persons like we had. Kenya has already had registered one death person there. And maybe finally, the person in Hoima, is that a Ugandan case or it's also a foreign case? And finally, the ministers and the other officials of the ministry, are they also under quarantine, or are they, because once you keep working and interacting with them, then we also need to know, are they also being quarantined or something has happened to them, the minister and maybe the other officials? This is a question that has come here, is the minister and others, but that's what we need to hear from you. I do not want to say why or not why. We need to know that. And maybe the other question that had come in here was talking about the status of the mother of the baby, but you had earlier talked about that and said the mother is actually negative and she's faring well. Help us, Dr. Mwebesa, to just dispel these and give us clarity on these issues that have been raised before we let you go.
Thank you very much. Let me start with 112 billion. I wish we had it.
Which is 1 billion every day so far.
But we don't even need it. We don't need 112 billion because for the interventions that we have, we don't need that kind of money.
Okay, very good.
Actually, for our preparedness phase, You know, we had requested for 26 billion with 3 scenarios. The preparedness, the response which we are in now with few cases, and with a scenario of very many cases. And we justified to finance only 5 billion. That's what we needed at that time, which we have been using. But now we are in response. We shall certainly need more money. And the team working on it is finalizing the plan to request for more money and even request the donors. So 112 billion, we don't need it. And as of now, at least with the scenario we have, we don't need that. And $1 million, I don't know how you can use $1 million in one day. You'll need to be hiring, chartering planes, flying to each and every village. But we don't need that money. The money we need, I mean, we have used 5 billion in 3 months. In 3 months since and that includes supplies and materials, and all those materials we have sent to regional referral hospitals, we have sent to Mulago and everywhere. So if we lost a case, God forbid, we shall have to undertake what we call dignified and supervised burial. We do not release the body to you. We go and bury the case like we used to do for Ebola. So that's what will happen. But we pray God that we do not reach that level. I was seeing actually South Africa has over 700 cases and they have not lost any person, at least by yesterday. So we pray we also remain in that scenario. But I don't think we shall reach 700. God forbid. I think we shall contain this situation early. But we leave everything open. The Hoima case, what was the Hoima case? Oh, he's a Ugandan.
He's a Ugandan?
Okay. And as I said, this is a person who requested himself. He was not feeling well. He requested. He came all the way from Hoima up to Mulago.
Just willingly?
Yes, willingly. After realizing that he had symptoms which were similar to COVID, he came and we took a sample and he went back and we are going to collect him to give him professional assistance. Our ministers are with us and they are there. Why would they be in quarantine? The last I remember my ministers traveled was when they were in South Africa for PEPFAR funding. That was in March 6. So even if they had come with anything back from South Africa, by now they are already out of danger. Yes.
In quarantine.
I'm really not aware of any government official in quarantine. At least not to my knowledge. I don't know. The government official at what level? What level are you talking about?
There are some government officials who actually picked their relatives from the airport. We know the names, but
and picked and put them where? No.
The minister Monica Mukama agreed on social media that her children came from Canada.
Walter, why didn't you just stand here to be seen on camera or something? Just because they need to know, they're looking at the Director General.
All right, thank you very much for this opportunity one more time. My clarification is about understanding if there are any government officials under quarantine. Because yesterday, Dr. Atwine accepted that there are government officials who picked their relatives at the airport. And we have also seen Honorable Molly Kamukama, who accepted that her children came from Canada and are in about day 5 now, or day 6 of self-quarantine or institutional quarantine.
Yes.
Yeah, so we would like a clarification on that matter. Thank you.
She said they're in institutional quarantine. Kamukmole. So what's wrong with that?
So is there any other official?
No, Mole is just an example of those that I think he wants to know. Mole Kamukama.
So that was a very good example. Mole picked her children. They came from Canada, picked them, took them institutional quarantine. And you remember, there was also an option for people to choose hotels they wanted. Not everybody was forced to be in Entebbe. Some people chose Kampala, and others chose any other hotel which they thought was adequate and good for their children. So that was okay. At least, as long as you kept your children in the hotel, you did not visit them, and you do not invite them at home for dinner. Or come and have dinner, then you go back to your quarantine. That would be a problem. But if they are there, they are eating in the hotel, and the hotel is following the guidelines for quarantine, I think that's very okay.
Okay.
So are we making more questions?
Well, no, I think we just need to...
I need to summarize now.
Yes, you need to summarize.
Yes.
You need to summarize,
Yes.
and we'll get all together sometime later,
Yeah,
but
I
you need
think
to
so.
summarize.
So I think in summary, I want to emphasize, like my colleague said, the preventive measures.
Sure.
Because in this country we cannot afford those overwhelming numbers you are hearing. Like in South Africa, 700.
In Egypt.
Like we are hearing Egypt is around
Egypt's about
450 something. Like in
Cameroon,
Europe,
Ghana,
the Cameroon, they are not very far from us, but I think we can't manage those numbers. So we must intensify the preventive measures so that we keep these numbers as low as possible. Our teams will do the best they can to make sure they identify all the contacts and make sure that the contacts are advised to stay isolated so that we keep monitoring them and testing them so that they do not spread the disease into the country. If you realize, apart from the German case, which is still tricky to us, but we also believe it was an importation from a neighboring country, most of the cases in this country are imported cases. So if we can restrict and control where we are now, we are likely to be safe or to reduce the numbers. But if we do not control them now, then these same people can cause more cases in the community, and in that case now we shall go in a very big problem. So our emphasis is, please, let's continue washing hands, avoiding shaking hands, and also we are advising people to stop treating themselves. We have heard of stories, people are buying azithromycin, chloroquine and what. Please, if you are sick, go to the health facility, you will be helped. Stop treating yourself. You may even cause resistance for something which was easier. And finally, I also want to emphasize the issue of the stigma. Let's not stigmatize our people. If we are to encourage them, let's encourage them to go for help in official health facilities, but let's not harass people because they traveled also and so came back from Dubai yesterday. Let's not harass people. And let's stop the anxiety. Let's stop the anxiety within the community. This is a disease which has come, it will pass. And if you are sick, you can be helped. We know that many survive. So let's stop the anxiety, because the anxiety is really very high. And actually, the bigger problem we have now is anxiety. So let's stop the anxiety. Thank you.
And I think you need to manage that more, because but when somebody is told that your member of the family is actually tested positive, they would really want to know how to actually manage that and start thinking, maybe I touched or they touched or did all the things. So the anxiety, the fear factor, because now even if somebody just sneezes or grabs a headache or anything, they tend to think this thing has actually arrested them, and that's why it is. I want to thank you so much, Doctor, and maybe finally, please make it a point to also give us this very big numbers over the negatives as much as you can, because it also encourages us a little if we know that out of 190 something we had only 4. So even if they came out under 80 and there is no positive, please let's also get these numbers, which will encourage us and as we also continue doing what we are continuing to do. But I want to thank you so much, Dr. Mwebesa from the Ministry of Health, Director General of Health Services, and Mr. Kabanda here, the Acting Commissioner of Health Services and Health Promotion. Well, we just promised that, like May committed and said, we will give these regular updates to actually know what is happening. But remember, from where we started from is there are so many vendors of lies and of
Mwebesa, who is from the Ministry of Health, that has, together with Dr. Richard, High Commission of Health Services, addressed 4 cases in the country to do with what is happening, and that we should avoid the stigma and support each other in this period, and continue to wash our hands and watch out your neighbors. Thank you for joining us.